Thanks, Chris. Okay, right. Here we go. I've got my, just a moment, let me get started. Really nice to be chatting to you all. So pleased that we can do a summer school this summer, all things considered. I think it's really impressive that you've all managed to come and that Chris and the gang have managed to sort this out. So applause all round. What I'm going to chat to you about is I am like proper posh title up there. I'm an associate professor in transfusion medicine, and ECC stands for emergency and critical care. But basically what I do is I'm a clinician working in the small animal hospital at the Royal Vet College, and I both see cases, help people treat those cases, and I do some research, and I also do some teaching. So I do a bit of everything. I love my job. I'm super, super lucky. And what I want to do with you today is talk about dealing with animal emergencies. And I'm just going to talk about dogs and cats. And I'm going to talk about how that happens. And I'm going to ask you a few questions. So we'll see if the chat does work. I'm going to ask you a few questions along the way. And I'm going to want you to think about things that you see. But before although the focus is very much on a physical exam, which is so important, so an examination of a dog or a cat when they present as an emergency, there's a bit more to it than that when we see an emergency. And basically, so this is the lovely QMH you can see here in the picture. That's our lovely hospital. And when animals arrive here as an emergency, dogs and cats, we triage them. Okay, so triage, you may have heard the term. It comes from the French trier, to sort, if any of you are French speakers. And the idea is that when you triage a patient, this happens to you if you go to A&E, a human hospital, they decide how urgently you need to be seen. And in some ways, you kind of want to be down the bottom of that list. Yes, it means a long wait, but it means you're not that sick. If you get rushed straight on through, that's actually pretty concerning. So that's the aim. When we see an emergency patient, we say, okay, how urgently do they need to be seen? Can they wait? Can they not wait? And if we have several emergencies, who do we need to prioritise? And so that's super important when we see emergencies, because what we don't want to be doing is dealing with a dog that has a really long-term problem that could probably be seen the next day, but the owner's very worried, while there's a cat that's extremely ill, potentially dying, waiting. So that's why we have to triage all our emergency patients. So how do we do this? Well, what we do is we do something called the ABCs. We get a capsule history and we do a major body system assessment. And we're going to go through each of those with you. But this is the basis of triage, determining which patient is most important. And the major body system assessment, which I'll come to last, is going to be the main focus of this because that's our physical exam section. The ABCs, which we start with, is there an airway? And if there is an airway, is it functioning? B, is it breathing? So, okay, yeah, you may have an airway, but is the patient actually breathing effectively? And then finally, is there a heartbeat? Is there a circulation? Is there a heartbeat and pulses? Because if there isn't an airway and the patient isn't breathing and doesn't have a heartbeat and pulses, then, to put it brutally, this patient is dead or about to die. So you may see an animal that still has a heartbeat and pulses, but they can't breathe effectively. And in that situation, we're going to need to start cardiopulmonary resuscitation, CPR, very quickly. So there are some situations when a patient presents, often maybe this is most commonly after, say, traumatic episode, they've been hit by a car or something like that, maybe they've had a great deal of blood loss, and those patients need to have immediate cardiopulmonary resuscitation. We're not going to be doing a physical exam on these patients, we need to just keep them alive if at all possible. That's another lecture for another time though, how to perform CPR. So if we've done our APCs and we can see that our patient is alive and not about to die, then our next step is we get a little bit, just a very, very brief history from an owner. Now, you may have spent time in a vet practice and you may have heard owners talk about their patients and tell the vet information or the vet nurse information about what's been going on. And you're probably aware that particularly if an owner is stressed, and you may recognize this in yourself, if you're stressed, you don't tend to be very good at being concise. And so one of the really important skills, I'm so sorry, my pager is going to go off like annoyingly throughout this, so I'm sorry, try to ignore it. One of the great skills, if you can, as an emergency vet or nurse, is to try and keep owners on track and brief. Okay, what do we really need to know if an animal is presenting as an emergency? Interestingly, age, breed and sex of the patient are really actually quite important, because there are certain diseases that are much more likely in older dogs or cats compared to younger dogs or cats. Certain breeds have certain diseases predisposed to them. Put really simply, you're not going to get a problem with a dog's prostate if it's a female, for example. So that information is really important, getting that straight away. And what's the owner's perception of the problem? Why have they brought them there? It may not be immediately obvious, but they may have vomited 24 times in the last 6 hours. So what's happened? How long has it been going on? Are they able to, have they been eating and drinking? Are they moving around like normal? Are they vaccinated? And are they on any medications? Any that the vet, their usual vet has prescribed? And also any that they've decided to give as well, because sometimes, for example, we might see animals that have eaten something they shouldn't have done. Say maybe they've eaten, I don't know, owners often know maybe that chocolate might not be good for a dog, and I've certainly seen animals where the dog has eaten chocolate and then the owner is given maybe salt water to try and make them sick, and actually the salt water could be just as dangerous as the chocolate, for example. So anything they've been giving. So trying to get that information very briefly is a skill. So once we've done that, this is our patient, they've arrived, we check they're still alive, we've got this brief history, and now we want to perform a physical examination. And I just want you to think a moment now. I won't ask you to put this up. Actually, just think to yourself, how can you maximize success in your physical exam? What kind of things do you think would be super useful to help you be as successful as possible, get the most information out of your examination of a dog or a cat? So the physical examination is just where we use our hands and our stethoscope, pretty much that's it, to examine a patient. Maybe you can think of some things, maybe you can't. And maybe you'll just think of some of the things I've put up here, and maybe you've thought of some others. And I think in the title of this, it's about a thorough physical examination, and being thorough is very important, making sure you don't miss anything. And if you do go on to be a vet or a vet nurse, then actually being thorough involves probably creating a routine, so that if you do the same thing over and over again, you don't miss things. So that's super important. Starting right from the beginning. And in emergencies, it's so easy to get flustered and sort of get distracted by one particular thing, and start looking at that only, say if there's a big wound somewhere. But you need to go back to basics and make sure you do a good, thorough physical examination. But it's actually not just about your skills. And I know that I saw that Liz Chan spoke to you earlier in the week a little bit about professionalism and that side of being a veterinary surgeon. Ensuring a good rapport with an owner is really vital to making sure you're successful in your physical examination, because if they're not on your side and they don't understand what you're doing and why you're doing it, you won't get these as good as information as you would like to. Obviously, it's important to ensure a good rapport with the patient as well. And also knowledge is important. What's normal for the species? Because if you don't know what's normal for the species and the breed, then you can't recognize what's abnormal, because you're trying to work out whether it's a normal deviation or not. So yeah, absolutely. Knowing that species and that breed is vital. And all you can do for that is practice. I've also put down know that patient, which I think is great if you are seeing the same patients regularly. In emergency work, often they're patients you've never seen before. But yeah, ensuring a good rapport, introduce yourself, say hello. It sounds silly, but often again, in a stressful situation, people kind of go in and grab the animal. No, you can't do that. Let's just give them a moment to recognize you. Particularly, I've got me and a cat here. This is me from about 20 years ago or something. You're saying, with cats, they're very easy to stress out, but dogs too. And if you go in and grab them, you're much more likely to get a not so friendly response. So say hi, putting your hand out, letting them examine you as well. And from an owner point of view, the dog or cat does not care, and obviously doesn't understand what you're saying, but you will really annoy many owners if you get the gender of their dog or cat incorrect. And as the owner of a poodle, I realise that everyone thinks poodles are girls, but you know what? 50% of them are boys. So make sure you get that right. Fine. So I promised you we'd talk about the major body systems. That was the third part, remember, of our triage, of our sorting out what goes on with patients, okay? We've said, are they alive? We've got this brief history. We've said a brief hello, and we're going to do this major body systems assessment. And the major body systems are these three systems here: the cardiovascular system, so you know, our hearts and our heart, but also all the vessels. Our let me move you, sorry, Chris. Our neurological system, so the brain, the spinal cord, and all the nerves going off, and the respiratory system. And these are really important. The reason they're called the major body systems is because if one of these three systems stops working, you die. Okay, your patient will die. So you must try and make sure that you are checking very quickly that these are functioning effectively, because if they're not, then we need to treat and try and improve function of one of those systems. Fine. Really though, when you do a physical exam, you're going to say hello. And the next thing you do actually is just look. You look at your patient, initially just from a distance. And again, as I said, I know I keep saying about rushing in, it's very easy to do. Just look at your patient first of all. Initially just from a distance, use your eyes, use your ears, think about their behavior. Is it normal? Is it aggressive? So the neurological system, their gait, that means how they walk. Are they ambulatory? That means can they walk? So those two tell you about the neurological system. And breathing, how they're breathing, that tells you about the respiratory system. So let's have a look. I've got some cases here, and I might ask you just to pop in the chat what you think. So this is a Labrador that presented to us. Oh, Fran, I'm just going to deny you there, but let me know if you... yeah, I can carry on. So I'm just going to play that again, and then if anyone wants to, or you can start scribbling in chat now, just tell me if there's anything you think is abnormal with this dog.
So Karen, we've had a couple coming through. Would you like me to feed back some of the points?
That'd be great, to save me having to go through into the chat. That'd be brilliant.
Fantastic.
Oh, I think this is all of them coming through, aren't there?
Yes.
I've turned that off now.
So Yanashina said abnormal breathing. Robin said excessive breathing. Paige, something similar, rapid breathing and panting. And that's followed up by Carrie as well. Audrey, rapid breathing. Philippa seems to be breathing rapidly, okay. Panting. So lots of...
there, Chris, I think.
Indeed, I think they might be watching intently to this talk.
Yeah, and I think you're completely right. Look at that breathing. Yes, the dog's panting. And panting can be very normal. Many of you are very aware about dogs and know that dogs pant. They pant when they're excited, they pant when they're happy, they pant when they're sad, they pant when they're stressed. They basically pant the whole time. But this dog, if you look, so you could just, very easily just go, panting dog. But it's really panting very fast. Look at that chest wall movement. It's very, very fast. And what actually happened with this dog, you can see the clipped patch over here, it actually had a buildup of air in its chest, between the chest wall and the lungs. It had a pneumothorax. And that creates a very classic rapid breathing pattern. Okay, and so yeah, on just observing from a distance before we start, you just pick up and then go, no, that's panting a little too fast. That chest wall movement is maybe a little more excessive than I would expect. Okay, let's look. Sorry, this one starts with a weird bit, but it doesn't last very long. But watch the dog, and then again, if you can make some comments, I'll play it a few times. Yeah, just going to deal with these ones. Yeah, I think Alex is going to do that in a moment, and that's going to be here in a second. Any comments, Chris? Anyone thinking anything?
We've got sort of disorientated and drowsiness. It might have just been me, but didn't hear much sound on that one. It was quite faint.
No,
So
this is just there's no sound required for this one.
Fantastic. So Yanashine again with glossy eyes. Robin sort of not necessarily concerned, but unusual head movements, drowsiness, stress, sensitivity to light, and there are a few themes.
Yeah, so yeah, again, like it's really hard, I think, to put your finger on this one. Like, he's weird, isn't he? Like, is what I would say. This dog is weird. And he's kind of swaying his head and he just doesn't look quite there. This dog actually had a very rapid change in sodium in his blood, and that was affecting the way his brain was working. So again, just looking really quite odd. What about this guy? This one is the sound on this one that's more useful. Let's try him one more time. What do people think, Chris?
So quite a few coming in. We've got sort of asthma question mark from Tim, difficulty breathing from Alicia, laboured breathing from Gio, long drawn out breaths from Abby, Savannah, difficulty breathing. So all focusing on the panting and the strange noise.
Yeah, so the noise there, I think, is really key, because you're right, there's definitely difficulty breathing. And I think with the asthma, maybe that's related to sort of the wheeze that people often have with asthma. This dog doesn't have asthma. What it does is it has something wrong with its upper airway. It's causing an obstruction. And a classic thing, if you have obstruction in your upper airway, is increased noise. And if you look, it's difficult, the video isn't amazing quality, but you might be able to tell that the noise is on inspiration. So often with asthma, it's noise on expiration. But yeah, noise on inspiration here. And that's classic for an upper respiratory tract, a problem with their larynx, pharynx, their upper airways, okay? He's got something called laryngeal paralysis, poor dog. And this is the last one I'm going to show you. So again, this is me. I don't always, I look very egotistical here showing pictures of me. It's just that often people don't want to be filmed and I just don't really care. So this dog, I think you just want to watch really carefully. Good boy. Okay. I think there's a few things you could probably pick up on in here. Let's watch him again. I like my sort of totally gormless expression there. I can't keep my mouth closed. What do people say, Chris? Anything?
So Abby's come in with sort of a strange way of eating and wondering whether it's able to move its jaws correctly.
Oh, well done. Yeah, good point. Good spot. He can't open his mouth properly, actually. It's called prehension is the proper word. He can't open his mouth properly to get that food, but there's other things. Did anyone say anything else?
Yeah, so Robin's looking more around the eye area and saying it seems to indicate maybe a bit of stress, or definitely seems perhaps abnormal.
Yeah, when he'll turn around in a minute and you can see his eyes looking, they look super stressed, and there's a reason for that. But yeah, look at those eyes. Don't they look weird? And they're actually almost pointing in opposite directions. Yeah, anything else?
So Isabel's noticed sort of what she thinks is a bit of difficulty with motor movements more generally than, I guess, just necessarily the eating side of things.
Yeah.
Lots of things around the eyes, including from Scott. Yanashine about not being able to move one's mouth sort of correctly.
Yeah. Did anyone say anything about this back leg? Did anyone notice that?
No.
I think that's quite subtle. It's because you're so focused on the front leg, and I just love this. He's so desperate to feed. Look at his waggy tail. He really wants this food. And can you see that leg sort of stuck at a weird angle there? This dog actually had tetanus. So it's got a real stiff leg here. It can't open its mouth. You may have heard the term lockjaw is sometimes used for tetanus, and that's why he cannot open his mouth. This poor love, he's desperate to eat this food, but he can't, like I say, prehend it, pick it up. And actually the muscles around his eyes are all affected by tetanus as well, and that's why they look so weird. They're kind of being pulled in. The intraocular muscles themselves, the ones that hold the eye in place, are being pulled in a tetanic fashion, which makes it so weird. So yeah, I was testing here to see whether he was ready to eat, and he wasn't, unfortunately. This little tube here, we were feeding him through that, but he really wanted to eat. He ate a little bit longer, but yeah, he did really well. But I think all the dogs I've shown you did, actually. I just think it just goes to show that the only way you can diagnose tetanus is actually from looking. It's a classic way they present and the way they hold themselves and the way they look. So, you know, this kind of observation before you go in, carefully step back and look is so important. Good evaluation skills there. Well done, everyone. Right, let's go on a bit more. So we've looked at the animal. We've got that capsule history. We've looked at them. Now we can go in, and now I will let you touch your animal. Okay, and we're going to assess those major body systems. Okay, so they were the cardiovascular system, the respiratory system, and the neurological system. So let's start with that cardiovascular system. And when you think about the cardiovascular system, we have to think about the heart, but remember, we're also going to feel pulses. We're going to look at their gums, because the way the blood is pumped around the body affects the colour of the gums, and so that's our mucous membranes. And I'll show you about capillary refill time in a moment, what that is. What sort of heart rate should a dog have? Well, faster than us, and a cat faster again. But it does vary markedly with breed and size and excitement level. So cats tend to be faster, also a little bit more, because they're maybe a little bit more stressed. You'll find these rates are lower for your dog and cat at home generally. You can get an abnormal rhythm sometimes that you need to listen to with your stethoscope, and also you can get what's called a murmur. So the rhythm could be abnormal if there's a problem with the heart or sometimes elsewhere in the body, and also you can get what's called a murmur, a heart murmur, when the heart valves are not working effectively. So really careful listening to the heart. We can feel pulses. And the classic places to feel pulses in dogs and cats would be the femoral pulse, which is actually just a little bit up further than here, just by the side of the thigh there on the inside. And then also this metatarsal artery, which is down here just below the hock. So that's the equivalent to just behind my finger there. That's the equivalent to the point of our foot, actually. And this is like the length of our foot. So actually you could feel your own metatarsal artery. You can probably find it. It's on the sort of inside of your foot at the top. And that's the metatarsal artery. Really good, useful one to feel. Because if the dog or cat has poor circulation, that pulse disappears. And when we feel a pulse, now sort of bear with me here, maybe you can do this just because, you know, you're sat on your own, so maybe you won't feel too self-conscious. But if you put 3 fingers and feel for your own pulse, if you feel for your own pulse over by your, you know, there's your thumb, and if you just go down from your thumb on that side of on that side of the arm, you can maybe feel a pulse there. And as you feel it, if you put 3 fingers on it, you can sort of feel the pulse wave moving along from the top of your arm down towards the thumb. Okay, so that's this duration. Your pulse lasts a certain amount of time. It sort of goes up and then down. This is a normal pulse. If we put a catheter that measured pressure into your pulse, this is the wave it would produce. That works for some people not so fussed with physics, don't worry too much. But what happens is if there's a problem with your circulation, that normal pulse starts to feel a bit different, starts to feel a little bit narrower, it doesn't last as long, but it's a bit taller maybe. Then as time goes by, it gets weaker and weaker if there's a problem with your circulation. This is really bad, and it'll get to the point where it disappears. So feeling the pulses is super important, and feeling the character of them. We can also look at a dog's gums. They could be pale like this, maybe a bit pinker. And what you can do, and again, if you've worked in a vet practice, you may have seen people do this, like push on the gums and then look to see how quickly the gums become pink again. That's called your capillary refill time. And these 2 things, again, give you an impression of how well the patient's circulation is working. Right, shock. So when we do all this, look at our pulses, our check our heart rate, look at the mucous membrane color, check the capillary refill time. All of those things are trying to see if the cardiovascular system is working effectively. Because if it's not, you might be in something called shock. And when you say shock to most people, this is what they think, okay? But shock is an actual medical term. Shock, and here's your proper definition: a life-threatening condition of circulatory failure causing inadequate oxygen delivery to meet cellular metabolic needs and oxygen consumption requirements, producing cellular and tissue hypoxia. And this patient here probably, I think here, was in shock, this poor cat. But what I want to basically, what we can distill that down to is that shock is decreased oxygen delivery to cells. And decreased oxygen delivery, probably because, and if there's decreased oxygen delivery to cells, you start to see problems with your cardiovascular system. And shock can be caused by a few things. It can be caused by if there's a source of infection in the body, a really bad infection that can cause the blood to become distributed in abnormal ways. So the blood doesn't go to the brain, it sort of goes all to the skin instead. It gets confused. You may have heard of sepsis. That's one of the big killers in humans. It could be because you don't have enough oxygen delivery to cells because you just don't have enough blood. Maybe you're hypovolemic. So that's when you've got decreased blood. Maybe you've bled. It could be because there's something in the way preventing blood getting to the heart. And that could be, there's certain, these are less common, that's less common, but you can get certain diseases that cause that. And then it could be because there's a problem with the heart itself. The heart isn't pushing blood out properly. Okay? And the reason I've put them in this order is this is how I remember them, because they're the causes of shock, these things, okay? But essentially shock is decreased oxygen delivery to cells, and it causes classical signs in our physical exam. So that heart rate we talked about, if you're in shock, goes up. The mucous membranes we looked at, they go paler to a point where they become white. That capillary refill time we talked about initially gets a little bit brisk and then slows down. The pulses, as I said, showed you, they change, they become, and as it gets worse, they become really, really difficult to feel. So that's why our cardiovascular system assessment is so important, because it can tell us if there's a problem with a patient and whether they're in shock, because if they are, we need to treat that quickly. Okay, so that's why we really focus on the cardiovascular system, our major body system. Okay. But there are three systems. We've thought about the cardiovascular. Let's think about the respiratory system. You did a really nice assessment for me just a moment ago, looking at the respiratory system and watching that patient from afar before we dive in. So looking at the how much effort they're putting in, how quickly are they breathing, whether they look abnormal or normal. And then we talked about sounds. So can we hear noise without our stethoscope? Then we get up the stethoscope and listen to the actual lungs themselves. And when, let me move you again, Chris. When we think about the respiratory system, we can kind of break it down into four places, right? There's the upper airway. Do you remember I said that Labrador we listened to had a problem with its upper, wasn't it? Oh, I can't remember what breed it was. It was a sort of speckly dog, wasn't it? But it had that real noisy breathing. That's because it had a problem with its upper airway. So it's larynx, maybe it's trachea, you can sometimes hear problems with, but they're noisy. Then you can have problems with the small airways. So these bronchi here, these bronchi here, and here. Yeah, they like that. Classic for that would be asthma, which cats can get. Then you can get problems with the actual alveoli themselves, called that pulmonary parenchyma here, the actual alveoli. And then you can get a problem with the space between the chest wall, so those ribs, and the lungs, and that we call the pleural space. And do you remember that dog that was panting really fast? That was a Labrador that was panting really fast, and I said it had air in there. That was in the pleural space. And the reason, again, our physical exam is super important is because, okay, we can see abnormalities on physical exam that are classic to each of those areas. Okay, so here's a normal dog. And I think it's really important to look at a normal dog or a normal cat. I said, you've got to know normal, haven't you? Yes, this dog is breathing, but you barely see any movement at all. You look at cats, you're like, are they breathing? You know, because they just make so little movement at the chest wall when they're relaxed. And the rest rate can be as low as 12 breaths a minute. The chest and abdominal wall move out together, and there's very little audible noise, apart from in some breeds, so breeds where we've bred them to be attractive to us, which unfortunately have led to other issues, and maybe caused some upper respiratory tract issues. So like a classic bulldog, or maybe some pugs, French bulldogs, those kind of dogs, and they kind of got that noise, and that's upper respiratory, that's obstruction of their airway that they just have the whole time. So let me just, if you've got a problem with your breathing, we talked about increasing respiratory rate and effort, but also sometimes the animals try and adapt. So they extend their neck, they push their elbows out, and they could also, cats shouldn't open mouth breathe. They can do it when they're stressed, but it also can be a sign of severe dyspnea. And you see really increased movement of the abdominal wall and thoracic wall. And sometimes their mucous membranes start to become blue. So if we look at this dog, can you see that increased effort there? It's a very short video. You can see it's already on oxygen. But look, it's got this classic long neck stretched out. It's sort of air hunger pose, some people will call it. And you can see the increased movement compared to that other very similar breed dog we just saw a moment ago. Look, you can see the movement of the abdominal wall and the thoracic wall much more, and it's much faster. So all around, we can tell this animal is not breathing normally. Okay? If you listen, we're chatting, but I can't hear any increased noise of this dog. So probably the upper respiratory tract less likely, but we can actually look a bit more. So that's probably the upper airway, probably not an issue. We don't have this noise, okay, that we'd expect. Is it expiratory? Hard to tell. Is it pleural space? I don't know that I can say that a classic shallow breathing that the other pleural space dog had, but what it did have when we auscultated it was it had very harsh, crackly sounds. So actually this dog had a problem with its alveoli, and actually, so here, right down the bottom of its airways, they had a pneumonia, a very bad one. And that's why it looks so bad. Right. So we're doing our physical exam, we're looking at our major body systems, we've looked at the cardiovascular system to see whether it's in shock, we've looked at the respiratory system to see if it has respiratory distress, and if so, tried to localize where that might be. Hopefully they're both fine. So let's just check whether it's okay from a neurological point of view. A neurological assessment is actually fairly easy. You just kind of look at how they are mentally. Are they mentally appropriate? Are they looking at us in the right way? So think about that little chihuahua that was kind of rocking its head all over the place. It wasn't normal. It wasn't really alert. It was more kind of mentally dull, and its behavior was not appropriate. Was it? And also think about that but if we think about our other one, our tetanus dog, that was alert. And we can classify mentation as alert, or getting worse and worse down to comatose. This was a poor trauma cat that arrived that was completely comatose. She's just lying there. There can be things that can prevent them from being neurologically appropriate. So sometimes if they have a low blood glucose, often we treat our trauma patients with methadone, and you can imagine that could cause them to become quite dull. But if we're not seeing things like that, is there something else going on? Have they got something mentally going on with them? The other thing, yes, is to look at, so going back to our tetanus dog, are they able to walk? Do they have any paresis, as in they can't move a leg appropriately or a side of their body appropriately, or any plegia where they can't move it at all? Is it all their limbs, or one side, or just the back legs, for example? You need to look at all of this. And then hopefully at the end of this, hopefully you found there's no problem with any of your major body systems. But if you have, then you kind of try and put it all together, because there's some things, so like with a problem with the heart, can cause an animal that has heart failure can have abnormal, say, cyanotic, those blue mucous membranes, but that also could be a respiratory issue. If a dog has really poor circulation, it may be that their mentation is poor, they're not very alert, because actually they're not getting blood to their brain. So you kind of got to put the whole thing together. But the important thing is, first of all, with an emergency patient, you find, is there a problem with the cardiovascular, the respiratory, or the neurological system? And then you can start to treat that, even if you don't know what the underlying cause is. So just to go over what we've done, and I'm going to come to a case example briefly in a minute. We've triaged the patient, we've checked it's alive, we've got our history, we've assessed these major body systems. So now what we need to do is try and stabilize them. And again, that is something you're going to look at if you do end up deciding you do want to be a vet or a vet nurse, and look at in more detail. But one of the things I always say, that we can, whatever is wrong, if they've had any kind of trauma, it's often very hard to treat patients, and we may not always be able to save them, but one thing we definitely can do is try and keep them as comfortable as possible. So for me, providing analgesia, which is painkillers, is really probably one of the most important things we can do. I'm just going to go over Bean. Is that all right? Have I got time for a quick case scenario, Chris?
Yes, we've got quite a lot of questions coming, so
Okay,
I think as long as it's swift, concise.
I'll be quick with Bean then. He was a Portuguese Podengo, which, to be honest to me, looked like a Jack Russell Terrier, but people like posh breeds. So basically, it was a dog that presented to us, a young dog. Been absolutely fine until that morning, when his owners noticed that she was quiet. And I noticed as well that her breathing was worsening over the day. So here she was when she presented to us. Shush, shush, please pop in. Yeah, that's me again. Now look. If we think about our major body systems now, I just want you to think about those major body systems. Sorry, I moved you. That confused it. If anyone can scribble down anything about the neurological, the respiratory, or the cardiovascular system now, that would be great. Hello, Hannah. One more go. Chris, shout out anything that comes through.
So we've got white mucus.
White mucous membranes. Yeah, absolutely. Look at those gums.
Pale gums.
Really pale.
Long capillary refill time from Ella. Sorry, they're coming in quick and fast. Dull, depressed from Carrie.
Brilliant.
Whimpering
Yeah,
from Sonam.
One-year-old Portuguese Podengo, whatever it is, it should not look like that, should it? This is a very flat dog for a one-year-old little, should be trying to bite my face off kind of dog. So yeah, very flat, very pale mucous membranes. Anything else anyone mentioned?
We've got rapid breathing from Venice.
Good. Yeah, look at that. We can see that in a minute, can't we, here? You can appreciate that a bit more. Yeah? So, actually, she's collapsed, neurological. Now I didn't tell you this, but she's tachycardic. She's got very fast heart rate, and her pulses are poor. And you guys picked up on her pale mucous membranes. And then she's got a fast respiratory rate, like you say. When we listened, her lungs sounded quiet, and she's got that increased effort as well. So all her major body systems have abnormalities. Those cardiovascular signs, so she has a fast heart rate, she's pale, she's got poor quality pulses, she looks like she's in shock. Her neurological signs, do you remember if I said her perfusion was poor because of her cardiovascular system, then they can become flat? That's probably what it is. And her respiratory signs, she's got respiratory signs, and she's very quiet. She's quiet when we listen to her lungs. She's probably got a problem with her pleural space. So we did an ultrasound, and we did an ultrasound of her pleural space. This is her heart. This here is a load of fluid. She had fluid in her chest. And actually, because she was so pale, we were like, that's probably blood. She'd bled into her chest. And what she'd done is she'd eaten some rat bait, and the rat poison caused her blood to stop clotting properly, and therefore she was unable to. She became collapsed and presented to us as an emergency. And this was her. You can see there's a little bit of blood going in here, another dog's blood. This is her. I think this was genuinely, this was about 6 hours later. Perky, nice and pink, a winner. So essentially, when it comes to physical exam, concentrate on your normal patients. You can practice on your pets for now, find out what's normal, practice loads, and then you'll be amazing by the time you decide to come to vet school and come on to the more clinical stages, of course. So you said we had lots of questions. So
we do, Karen, yes. The first one we've got from Keisha is sort of wondering with regards to patients coming into the practice. Are they staggered? Obviously, with emergency cases, they come in when they come in. So does triage also include not just deciding in the waiting room who you go to, but you've got that first patient and then another animal comes in and you have to triage in that sense, not just sort of in the waiting room, as an example?
Yeah, so we triage. If they're at all sick, they come through, and it's often the case that we're working on one patient and we triage and another patient arrives that's sicker, and then we say, right, you go sit in the cage for a moment. And our emergency room is very like that. Our owners often have to wait quite a while because it involves, but kind of like you do when you go to A&E. I mean, I've sat in A&E with my kids for hours, but you know that, like I say, when you're sitting waiting, it's good. And that's what I try and instill in my owners, but sometimes they get a little frustrated.
And I guess similarly, just to mention about the QMH, it's not a case of there's just one bed in the sort of emergency room. It's you'll see many patients within there, so it's not sort of necessarily common that it's one at a time type thing.
Yeah, absolutely. Yeah, no, we're busy on the weekends, particularly. It's really busy. It's really fun.
And we've got a question from Alex, who's asking how you get a clear patient history from an owner when they are distressed. When you mentioned earlier, they might not be as concise as you would like them to be.
It's really hard. And so, you've got to be understandable. And I think one of the things I remember when I was in your guys' positions, that I was seeing practice at a vet's, and the vet said to me, oh, you don't want to do this job. It's not about animals, it's about people. And I was like, yeah, of course it is. And that's what I really enjoy. I like people. But that's it. You've got to enjoy that rapport, and part of it is about helping people and allowing them some time, not, although you want to be rushed getting things done, not rushing them, and not allowing. It's often, I think, an emergency vet, a lot of being an emergency vet is actually trying to control your own emotions so that you don't stress those out around you, and that's both within the clinic but also with owners, and I think stressed people are easier to deal with. Angry people are not uncommon either, because again, they're just so upset, and so people often will become angry about a weight or money, but actually what they're really angry about is the fact their pet's unwell and they're worried about them. And so it's being understanding of that situation, but I think every person needs a slightly different approach.
Yeah, and we had as you mentioned earlier, Liz mentioned that on Monday with regards to the typical reaction. It tends to be anger. And if I might link the being under pressure, when you guys get through to interview, as sort of Karen alluded to, we hope that you do decide to apply to the RVC. Remember yourself, you're going to be under pressure, and I know we have a applying to session tomorrow, as well as work with Ruth on communication, but really focus on being concise during interview, because 5 minutes can very much fly extremely quickly. Back to the questions, Karen. We've got, I guess, a bit of clarification, and it might be a geographical thing. We've got students from, I think, 11 nationalities, if my memory serves me right. Just wanting a bit of clarification with regards to tetanus and lockjaw, and is it the same thing?
Yes, yeah, absolutely. Yeah, no. And I think sometimes you forget, don't you, when I use terms that are not so easy to understand. But yeah, lockjaw is a colloquial term, so a term used often for people with tetanus, and sometimes people use it in horses, sometimes people use it in dogs as well. But yeah, and it's literally called lockjaw because you can't open your mouth, and so that's across different species. It's not common in dogs, it really isn't. Horses are actually vaccinated against it because it's more common, and we are too. But yeah, interesting, really interesting disease.
Question from Yanashine. I guess based on both your mention with regards to a murmur, but also the different heart rates of animals, does a murmur in an animal sound the same as it would in a human?
I'm trying to think of one of my friends has a heart murmur, and I seem to remember auscultating her a long time ago. I think so, yeah. I've not auscultated many humans, but they're in different species, so they sound similar in dogs and cats and horses. So I would imagine they probably sound the same in humans as well. Like, it's always a bit orcs to auscultate a person. So.
Thank you. We've got a question from Alexa, who said, how would you differentiate between a nervous dog with an increased heart rate and a dog that comes in with a problem such as tachycardia in general practice?
Oh, such a good question. It's so true. And, you know, that goes back to that panting, as I said about dogs. You know, is it panting? Is that okay panting? Is that not okay panting? So do you remember that last slide I had, which was like putting it all together? So if they're tachycardic, say their heart rate, you've got a dog with a heart rate of 140, that's fast. But the dog is really bright, it's trying to lick your face, its pulses feel good, its mucous membranes is nice and pink, it's mentally appropriate, there's nothing else that tells you that dog is concerning, then I wouldn't be too worried. But if, you know, if you've got a dog lying in lateral recumbency and can't stand up, and its heart rate is 140, that's when I'm worried. And so but sometimes they can fool you. You're like, oh, this dog looks really bright, he's fine. And then actually you go back and his heart rate's still 140, like say 20 minutes later, and he's settled now. And why is it still that fast? So I think, you know, they can sometimes mask illness. So if you're not sure, the key with emergency and critical care is to keep monitoring, go back and look again, go and check again. And so trends are really, really important.
Fantastic. Isabel has asked, if the conditions overlap in the MBS assessment, how do you know which system is the key root of the issue?
Yeah, and again, that can be difficult. I think it's, so for example, Bean, that last one we had, that little dog, she's so cute. It fitted that she was so pale and her heart rate was fast, and everything fitted that she had such a strong cardiovascular problem that we presumed her neurological system was problem secondary to just decreased oxygen delivery because of her problems with her cardiovascular system. But sometimes you go, okay, well, I've sorted the cardiovascular system out and she's got better, brilliant, that was what I thought. Or you do it and she's still not right, okay, I'm missing something here. And so that's what I love about emergency work. You're kind of doing it on the hoof. You're like, oh, like, let's try this, okay, no, another problem, now what do I do? You know, it's kind of fun. But yeah, you're right, it's not always obvious.
We heard from Sam McGaw, who, sorry, Sam was in the photo, wasn't she, that you showed towards the start, who said that's one of the same reasons that she loves emergency critical care. And one of our graduates, Zoe, came back, Zoe Mitten, to say exactly the same. We've got a question from Tim, who's saying, how can you tell the difference between laryngeal paralysis and a collapsing trachea? Would you be able to see this on an X-ray? And would the treatment be similar?
Good question. So they both sound similar in terms of you get noise with both of them, but do you remember I said right at the beginning that signalment was so important? So learning about their breed, so laryngeal paralysis is much more common in big dogs like, you know, Labradors, standard poodles, Great Danes, big dogs. Tracheal collapse, little dog thing. So toy breeds and little Yorkshire Terriers are classic. So actually, it's very uncommon to get a little dog with laryngeal paralysis or a big dog with tracheal collapse. You can see tracheal collapse sometimes on radiographs, not always, and laryngeal paralysis, you have to diagnose by actually anaesthetising them and then looking in their airway and seeing how their larynx is moving.
Thank you. A question with regards to rat bait now.
Oh, yeah.
Are there any long-term problems caused by that? That's from Keisha.
So the one that Bean had was one that stopped. There's lots of different sorts of rat bait, but the most common in this country is one that stops your blood from clotting effectively. It's related to warfarin, and if you can treat them and stop the bleeding, so we treat them with plasma and a vitamin K, because that's what it stops vitamin K from working properly, then they tend to do really well. But if you don't catch them early enough, they can bleed to the extent where they die. So it's not nice. And also it requires the owners have enough money to treat, which can sometimes be sad, and they don't always have.
So I think the message is, if you are getting rat bait or indeed slug poison as well, make sure you get one that's pet friendly.
Yeah, or just keep well away. And you know what? Often owners, the vast majority of people who have animals they bring in with rodent rat bait poison, they say they know it's on their premises. They just didn't think their animal could get to it.
Yeah. We've got a question here. When listening to the heart, is there different sounds you should be listening to, or is it just the rhythm or the beat?
So there are actually 4 sounds the heart can make, and in dogs you hear 2, and cats you hear just 2 of them. So the lob dub essentially, and you can sometimes hear another one if there's ill health. So it's partly the rhythm, but it's partly just listening for that. It should be a regular ba-bum, 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 and if it's not, then they've got a rhythm abnormality. And if the sound is slightly slurred, that's when you get what's called a murmur.
Fantastic. A few of our students, including Carrie, is wondering, say one wasn't able to find out which of the major body systems were causing an issue, is there one that you would go to as a first port of call? So is one more important in terms of triage than the other 2?
I think if you're not seeing I mean, lots of animals present as emergencies that don't have problems with them. So if you don't see an overt problem, that's fine. But just keep an eye on them. And if you're worried and you're like, I feel like I might be missing something, give them 20 minutes, go back, check again.
Okay, fantastic. And we've got a question with regards to I think it's the Student Veterinary Critical Care Society, and how much involvement do they have with perhaps the QMH, or I don't know whether you know if they do anything at the Beaumont Sainsbury.
No, I don't think they do anything at BSH, but at the QMH, they have previously been involved with our blood donor service, which is super helpful. So they come in and help hold the animals when they give blood, which is really nice. And we do lots of talks, but actually spending extra time on clinics, the way to do that, actually any of the students can apply to spend extra time EMS on clinics with the emergency service, and that's not infrequent. And there's a lot of the specs people do that.
And I think you mentioned slightly earlier about the weekends being particularly busy.
Yeah.
And I just want to remind the students, and you might want to add a little bit more, Karen, that when you're a student at the RVC, it's not like let's say a less vocational degree program like English, where you might do 9 to 5 Monday through Friday. You will be working.
Let's face it, 8 till 10 Monday.
Indeed. Apologies if there are any English graduates on the call. But you'll be working out of hours potentially, as well as it's heavily staffed by students over the weekend, I believe, especially in emergency critical care.
And I think the vast majority of students love that, because you're just really starting to see the clinical cases and they gain so much from it. So yeah, vast majority of students really do love that. There are some people who don't want to be a practicing vet, and that can be a bit more of so maybe they're more interested in the basic science side of things, which, the vet degree is still a great degree for, but you do have to go through that program and that aspect of it. But even then, I think some of those students, that just because it's not what they want to do long term, it's still interesting.
Mm. And I don't know whether this is something which you've experienced much in your professional career, but do you ever get owners sort of lying or perhaps not giving you the full truth? And does that happen frequently or infrequently? And what would you do in that sort of a case?
I think yes, it does happen, but it is infrequent. I think the classic would be if you are suspicious that a dog or cat, usually dog, might have ingested some illegal narcotics, some illegal drugs or recreational drugs. And then that's very careful questioning and making the owner realise that actually you just want to make the animal better and you're not interested in reporting them to the police for their marijuana stash. You just wanted them to know that you just need to know so that you can treat effectively. I think the other one I had once that was so sweet was a dog that presented and it had a pneumothorax. So again, like that Labrador, actually, that's not all I see, I promise. But it was a little dog, it was unusual, and it just had a pneumothorax and we had no idea why. And I was speaking to the owners and I said, look, can you think of anything at all that could have happened, And they're like, no. And there was a little kid, he was only 8 or something. And he went, how bad would it have to be for it to happen? And I was like, well, it might have to be a fairly decent thump. I tell you what, why don't you have a really good think and speak to your mum and dad? I believe you have a chat with mum and dad and see if you can think of anything together, you know, because he clearly was terrified about saying, because he thought he'd induced this and he hadn't. But like, you know, it's about being sensitive to the situation and trying to make sure you realise they're on your side, and it's not about a blame game.
Fantastic. We'll take two more questions if you've got the time, Karen. One from Alex, who's asked, how would you deal with an animal if it became aggressive during a physical exam? And I'm going to guess your answer is going to be you use the support network of the team around you.
Yes, but also sometimes we do have to sedate them, and that's for our protection, but also often for their welfare, because again, severe aggression, it may just be they are very aggressive, but then if they're very aggressive, it's usually because they're scared or because they're incredibly painful. And in both those situations, it's usually nicer for them and us to sedate them if we're able to, if they're stable enough to, which they usually are.
Fantastic. So I'll leave it with this last question, which goes back to one I've asked before, but I think our summer school students want to have a definitive, which I appreciate is not always the case, especially in veterinary medicine. If an animal was displaying signs, both their all three body systems were having an issue, would there be one that you pull out first to prioritize out of those three? So
You treat them all at the same time. So, for example, I guess a classic for that would be maybe, say, a dog that had suffered trauma. Maybe we get a lot of like little dogs that say have been hit by owners often stand on them. Yeah, say they stood on its head and it's bled, so it's got a problem with its cardiovascular system. Maybe it's got some bruising in its lungs, so it's having problems with breathing, and it's bled, so then it's got head trauma, so its brain isn't working properly. So you can give a drug which you can give fluid to improve its circulation, which will also actually help suck some fluid out of its brain, and then also you treat with oxygen at the same time. So you're not saying I'm going to do this, then this, then this. You're going everything together.
Fantastic. Well, I think it's a really nice question to end it on. Karen, thanks for your expertise and very engaging presentation. I know the students will definitely thank you during the through the chat's comment. But as your page has been going off pretty much
didn't have much choice there, did they, Chris? But yeah, no problem at all. And I think there is I think my email's on the website. So if there are any pressing questions, you're more than welcome to ask. But hopefully I've helped a little bit. Or you can put them via Chris, and Chris can forward them on to me if they're really, something you really want to find out about. I saw Audrey asked about marine mammals. No idea about them.
We're hearing from Jo later in the week.
Oh,
I'm not saying she'll necessarily know with marines, but maybe more that exotic side of things.
She knows everything. But yeah, no, thank you so much. I really enjoyed speaking to you, and I hope I do get to meet some of you in the future.
Brilliant. Thanks again, Karen. And to all the summer school students, if we head over to our next session, we'll start that as soon as possible. Thanks all. We'll see you there shortly. Goodbye.
Bye.